Hi, today I'm going to talk about some things you can do if you have asthma, which gets a lot worse after you have a cold. This video is about things you can do. There's going to be another video about things you can take, like medicines. Before you watch either of these videos, you should have watched the first one, Asthma and Colds, which explains a bit more about it. Okay, so the first thing is actually bed rest, and that means as soon as you get a cold. If your asthma is so severe that you're spending days, really struggling to breathe after you've had a cold, and you're in bed, and especially if you're having trips to the hospital, then that's honestly what you need to do. Bed rest, that means as soon as you get a cold, you're into bed. You're not sitting up watching the telly, you're not pottering around the house, you're not reading a book on the sofa or anything. It has got to be in bed, lying down flat. The reason for this is it actually helps to stop the amount of sneezing you're doing, and it also helps to stop the amount of over-breathing obviously you're doing when you're sneezing. So that the less you can breathe and the less harshly you can breathe, the better, and this really does work. It also does help to make sure you've got a warm room, because cold air is just going to aggravate sneezing and stuff, so make sure the room is warm enough. And instead of spending 5 days off ill with an asthma attack, you'll be 2 days off with a cold, so it's actually less time off sick. Now the other thing which helps is to get some heat on the area. So a hot water bottle, and you put it on your chest about here. Now the actual weight of it, it seems to help the muscles to stop twitching, and the other thing it does is, obviously because it's warm, it relaxes the area, and that's what you need for the area to be relaxed and as little as twitchy as possible. And the other thing to do is try some breathing techniques, because when you get a cold, you're sort of going so you're sort of getting into spasm before the asthma set in, so you're setting up a bad breathing pattern to start with. So stopping the sneezing is key. Now we all sneeze when we get a cold, but with asthmatics they seem to sneeze a lot worse, so you need to reduce it. So when you have an asthma attack, you're sort of taking a very sharp intake of breath, and then you're struggling to get the breath out. So you need to stop that pattern before it started. So, especially after you've just had a fit of sneezing or whatever, you just need to practice breathing as shallowly as possible when you're breathing in. Do it as slowly as possible. Hold your breath. Count. I count to about 5 usually. Again, breathe out as slowly as possible. So trying to keep everything as relaxed as you can and prevent it going into spasm. Okay, so the next video is about medicines you can take alongside this which help.